The U.S. Department of Education is really making it plain that nursing degrees are not included in its revamped narrow definition of a professional degree for the purposes of federal student loan access. So, what does this mean and why does it matter? The updated definition of professional degree now only includes 11 fields. There is a borrowing cap that is higher for professional degrees and lower for graduate degrees. I spoke to the president of the American Nurses Association about why they say this reclassification will make advanced nursing education harder to afford and it really could exacerbate the existing nursing shortage. Take a listen.
I am Dr. Jennifer Mensah Kennedy, and I am the president of the American Nurses Association.
Was nursing always considered to be just a graduate degree that you would like to be considered a professional degree?
Well, thank you for that question. And so, one, we know nursing's a profession, and nurses are professional.
Hmm.
So this rule, this proposed rule does is we, as nurses, advanced practice registered nurses, we're not explicitly ever called out in the list. But what happened in this updated rulemaking was we were explicitly left off. And so
Hmm.
we have been able to be part of those loan limits that all others could have prior to this. So we were considered, by default, by not being excluded.
And all of those other career fields, were they ever even listed before, or this is just a new designation?
So they're cleaning up and I think updating, for instance, clinical. And some people say, well, you know, maybe they just forgot us or they didn't add or change anything, but they did add clinical psychology, which they should have at the very, very end. But there's a lot of professions, health professions, that meet their definition who are left off. And so the fact that they left advanced practice registered nurses off, left nursing off, is unfathomable because for instance, nurse practitioners,
Hmm.
provide a majority of primary care services in the United States. Education is much more expensive. And so we need people to continue to go and get these advanced degrees so they can serve those who are in under-resourced and underserved areas, which are our advanced practice registered nurses. And then it is RNs because we need nurses to go back and become faculty members. I have my PhD and I completed that degree 20 years ago with $100,000 in school loans back then. Education is more expensive. And so, for instance, we had over 80,000 qualified applicants who applied to nursing school this last year who did not get in, right? And so we have a faculty shortage. Why would we then stop RNs from continuing their education to become faculty and just make this nursing shortage even worse, particularly with baby boomers, our aging demographics, and people retiring?
Yeah, I was going to say that when we talk about implications, we said it'll be more difficult for nurses to go to school. Can you run through the numbers? How much does it cost to become a registered nurse?
No, and thank you. And those numbers, of course, vary state by state. Geographic, regions vary differently, and it
Hmm.
depends on the program types that you might enter. And so it is not uncommon from nursing school to be just to become an RN to become $40,000 to $60,000. And I've talked to nurses who are spending $100,000 to become a registered nurse. So, that's widespread. And then if you look at doctoral education, so if you look at, a CRNA, which is a certified registered nurse anesthetist, they require a doctoral degree. And so when you look at all of their education, and we're capping it now at 20,000, I think $500 a year,
Hmm.
they're going to exceed that amount, gets exceeded most often every single year. And they're going to, not have those federal limits. And I think the important piece is these are federal limits. And so, people say, well, they can go get private loans. But when we look at public service loan forgiveness, PSLF, and we look at loan forgiveness programs for people who work in under-resourced rural areas, those don't pay back those private loans. They only pay back federal loans. So we're already further disadvantaging people who want to serve those in underserved and under-resourced areas by not
Hmm.
also supporting them in their, paying back part of their education for, working in areas where they're going to automatically get paid less. That's why so many rural areas don't have providers, is because they can make more money in the urban and suburban areas. So we have additional incentives to have people work in underserved, under-resourced areas for a reason. But
Hmm.
private loans won't be paid back in those instances.